The real emphasis is that today neurologists have the tools to examine vision and help the patients in terms of what their diagnosis may be and what treatment might be best for them. And so some of the tools that are now available to neurologists include low contrast letter acuity testing, OCT or optical coherence tomography, non-mydriatic photos, and visual performance measures, rapid number naming and rapid picture naming, that allow us to fortify the diagnosis, for instance, of multiple sclerosis or concussion. So the talk is going to go through that process of identifying those visual measures that may aid the clinician in making the diagnosis of these conditions. And in particular, we're going to emphasize that these measures can discover hidden disability, visual disability that's not otherwise recognized. And it's also going to emphasize that these measures, low contrast letter acuity, for instance, can detect therapeutic effect of medications that would not otherwise be seen if you were just looking at high contrast letter acuity testing. And then it will go on to show that patients that are thought, for instance, to have benign MS often can have hidden problems in their visual system that affect their quality of life. So what you think is benign may not be so benign if you're not measuring vision. And then from there, we'll look at how baseline visual function may predict future disability. We have, as well as the investigators at Johns Hopkins, have shown that, when you see a patient initially and you measure, for instance, their retinal nerve fiber layer on OCT, well, that, if it's very low, may predict that they're going to have progression of their disease. And therefore, right up front, that may help you make some decisions about what therapy to start for that given patient. And then, of course, visual performance measures. We have found that rapid number naming, rapid picture naming may aid in the diagnosis of concussion, but also can be good measures of dysfunction in other disorders, including MS, including Parkinson's disease, including Alzheimer's disease. These measures may separate out patients with mild disease versus controls.